Cancers are grouped according to the tissues where they originate. This is referred to as the primary site. For example, a tumor in the lungs or brain may actually have started out as a stomach cancer solid tumor that metastasized, and the cells traveled through the lymph or the blood to the brain and formed a new tumor. But when it is looked at under a microscope, it has the features of a stomach cancer cell. Carcinomas arise in epithelial tissue, the cells that cover the inside and outside surfaces of our bodies. Sarcomas arise in connective tissue, the tissue that forms in the bone and soft tissues of our body, including muscle, fat, blood vessels, lymph vessels, tendons, and ligaments. We also have leukemias and lymphomas. Leukemias are cancers that originate in blood-forming tissues. They do not form solid tumors like the carcinomas or the sarcomas. Lymphomas originate in T cells or B cells. Some treatments work better on certain groupings than others. That's why it's important to know what type of cancer you have, what the origin of the cancer is, the primary site, and we'll talk in a few minutes about the stage and the grade of the cancer. Symptoms vary depending on the type of cancer. Many cancers are asymptomatic in the early stages. I've been asked why, for example, pancreatic cancer is so difficult to treat. It's because pancreatic cancer doesn't provide symptoms until it is very late, until it has progressed. The same with cancers of the liver and of the ovaries. Signs often appear long before symptoms, so there may be things that you can see or feel that don't cause discomfort. For example, a woman may find a lump in her breast, changes in moles, or blood in the stool. So these are signs that can appear before you may have any symptoms. But what you need to know is that lumps, abnormal moles, and blood are not always going to lead to cancer. They are a sign that you need to have it checked out. Blood in the stools may be due to hemorrhoids and not colon cancer. But when you find these signs, you want to have them checked out by the doctor. Lung cancer is the leading cause of death in the United States. Second most commonly diagnosed cancer in both men and women. For women, breast cancer is the number 2 cause of death. Mortality means death. For men, prostate cancer is the second highest cause of cancer deaths. And then there are colorectal cancers, which are the third leading cause of death and the third most commonly diagnosed cancer. There are different types of lung cancers. You don't need to know the different types, but I want to share them with you. There's what's called small cell or non-small cell carcinomas. Small cells diffuse and spread more easily. The non-small cell is more easily treated. Again, this is not something you need to remember. This is informational. Average survival, if left untreated, is 8 months. Lung cancer is a very difficult cancer to treat. The earlier it is caught, the greater the chances for survival. 10 to 12% of smokers will develop lung cancer, but 87% of lung cancer victims are smokers. Other factors that can lead to lung cancer are asbestos, arsenic, and radon. Women may choose to do self-exams in order to become familiar with their breast tissue. Data suggests that it's not very effective in diagnosing breast cancer, but many women feel it's better than doing nothing. If you want to do monthly self-exams, make sure you do it at the same time every month because breast tissue changes throughout the month. The textures change because of the menstrual cycle. The suggestion would be perhaps 5 days after you're done menstruating to do a breast exam. Mammograms, I explained to you what mammograms were at the beginning of this topic. They're not very sensitive. They may miss some tumors. They may have false negatives, but it is still being recommended to screen women with mammograms, and I'll talk about that in the next slide. Some women are easier to screen than others, and that has to do with the density of the breast tissue. Breast tissue that's higher in fiber is harder to x-ray than breast tissue that is higher that contains more fatty tissue. MRIs may be too sensitive and detect many non-cancerous lumps. These would be the false positives. In 2015, the American Cancer Society released a statement saying that some cancers detected by mammograms would never have posed a threat to a woman's health or a woman's life. and that others are so slow growing that even if they weren't detected until they caused symptoms, they may still be treatable. Yet other tumors are so aggressive that even catching them early is too late. In these situations, mammograms would therefore have had little effect on whether or not a woman's mortality was affected. This statement was very confusing for women. It's still confusing for women. Screening used to recommend having women start getting mammograms at the age of 40. Now it's recommended to talk with your doctor based on your family history, based on your personal feelings towards having these kinds of exams, on whether or not you should have a mammogram and how often you should have them. Risk factors for breast cancer include mutations or defective BRCA1 and 2 genes, age. Actually, the number one risk factor for breast cancer is being female. I know that doesn't help, but that happens to be the truth. The defective genes and age are pretty clear risk factors for breast cancers. Other risk factors that are not so clear: women with no children or having children later in life, and hormone replacement therapy use. And this is because both involve the hormone estrogen, and estrogen may be related to the development of breast cancer cells. You may see products that tell you to buy them because they will prevent cancer. You may see advertisements for workshops offering steps to prevent cancer. Please know there's no way to prevent breast cancer. Even prophylactic mastectomy can't prevent breast cancer because breast tissue can be located in places that weren't removed during the surgery. But what we can talk about is risk reduction, or ways to reduce the risk of developing breast cancer. Diet and exercise, decisions made about pregnancy and nursing, tamoxifen for families, for individuals in families with a strong family history of breast cancer may want to take this drug. It does increase the risk of uterine cancer, but for some women, especially if they've had hysterectomies, taking tamoxifen can help reduce the risk of developing breast cancer. And the mastectomy is the most drastic action that can be taken by a woman, especially if it's prophylactic, done to prevent breast cancer. These are decisions that women who find out that they have the BRCA mutation often just make. Other female-specific cancers include uterine cancer, cervical cancer. This is, again, where I tell you, please get the vaccine, and ovarian cancer. Now, the grade and the stages of cancer are important in determining treatment. The grade of cancer is based on the shape of the cells. You don't need to know the specific details, but I'm going to give them to you. Tumors are graded 1 through 4 based on their level of resemblance to healthy, differentiated, or mature cells. The low grade are less dangerous. They look differentiated, meaning that you can tell the difference between the cells. The higher the grade, the more dangerous the tumor, because the cells are what are called undifferentiated. They may have multiple nuclei. They may not have well-defined cell membranes. These are signs of a more dangerous high-grade tumor. Cancers are also based on tumor size, penetration, and spread. So TNM stands for tumors, nodes, meaning how deep it's penetrated, and metastases, whether or not the cancer has spread. You will not be asked to stage or grade a cancer, but I just ask you to know that there are stages and grades of cancer that affect the type of treatment. This is a picture of different stages of colon cancer. Stage 0 is where you have abnormal cells located on the colon wall. Stage 1 means that they are starting to grow, and you can see as we increase in stage that the red lines are blood cells, are blood vessels. Angiogenesis is starting to occur, bringing nutrients and removing wastes from the tumor. By the time we get to stage 4, the tissue has metastasized and has spread to other organs. The screening test for colon cancer is the colonoscopy. And this can find tumors in early stages and remove them from the colon and prevent colon cancer from developing. Both stage and grade are important. It determines how aggressive the cancer is, the size of the cancer, and how much of the body it has affected. It also helps to determine what types of treatments are likely to be successful. For example, a low-grade cancer that resembles more healthy cells might have a wider variety of drugs that work against it. So the picture I just showed you on colon cancer, this is the number 3 cause of mortality from cancer in both men and women. Warning signs are blood in the stool. 90% of these cancers occur in individuals who are older than 50. Screening test for colon cancer is the ultimate master cleanse known as the colonoscopy. Okay, well, first we have a stool test where you take samples of the stool and it gets tested to see if there's any blood in the stool. A rectal exam where you have, yes, it's just what it sounds like, where a doctor wearing a glove will feel into your rectal area for any changes, for any lumps. But then there's the colonoscopy, where the prep, well, ask your folks, they might know about it. But what happens during the colonoscopy is that a very tiny camera, after you have properly prepped for the test, is inserted into the rectum and looks through the colon for polyps. Polyps are clumps of cells that may represent dysplasia or cells that are starting to become cancerous. These can be removed during the colonoscopy. So this actually is a screening test that can help prevent cancer. Male-specific cancers include prostate cancer, which has no signs or symptoms in the early stages. It's often slow-growing. It can be diagnosed by the PSA blood test that I talked about at the beginning. The thing about the PSA is that it doesn't tell you if it's a slow-growing cancer or a fast-growing cancer. This puts men in a similar position that women are in terms of deciding what to do with results of screening tests. Testicular cancer is the most common cause of cancer, well, guys, in your demographic. Self-exam, in this case, may be the best exam that you can do in order to look for changes in the testicles. There are 3 types of skin cancers, and it depends on the type of tissue in which they originate. Basal cell cancer, squamous cell cancer, and melanoma. Melanoma is the one that spreads most quickly and can be most dangerous. Skin cancer is the most common type of cancer in the United States. Non-melanoma is highly curable. Melanoma is the most deadly form. But what I need to tell you is that melanoma, when found in its earliest stages, is highly treatable. Risk factors include sun exposure and tanning lamps. Those tanning salons increase cancer risk. Why are you going? Warning signs, these are put out by the American Cancer Society. These are the guidelines for detecting skin cancer or changes in cancer, changes in moles on the body. A stands for asymmetry. B stands for border irregularity. C, color. D, diameter greater than 6 millimeters, and E, that it is changing or evolving. One of the reasons why I suggest your demographic get screened for this type of cancer, it's not because I'm worried that you have skin cancer, but this, at your age, it may be helpful to know your moles from your freckles so that if there is a change, you can have it looked at. There are 3 clinical possibilities for treating cancer: curing it, in which the tumor and all cancer cells are removed; management, where tumor growth is periodically suppressed when the tumor growth goes into what we call remission, but it does come back and then the person is treated again until it again goes into remission; and terminal, when someone has terminal cancer, the primary goal is to relieve any symptoms and to offer them palliative care to keep them as comfortable as possible. Treatments include surgery, removal of tumors and nearby lymph nodes, chemotherapy. You don't need to remember the different types of chemotherapy, but they are designed to inhibit Cell division, as we said, cancer is caused by cells refusing to die, that they continue to divide and divide. But some of the newer drugs may also inhibit new blood vessel formation, preventing that angiogenesis that I talked about, the formation of blood vessels that bring nutrients to the tumor and remove waste, thus allowing the tumor to grow. And radiation, which damages DNA of the more vulnerable cancer cells to stop it to grow. Unfortunately, healthy cells are also damaged, but hopefully they can recover. The thing about chemotherapy and radiation is that they both affect rapidly dividing cells. Chemotherapy is used if you have a blood or lymphatic cancer. Also, if there has been metastasis, because that means that the cancer has spread throughout the body. The goal of chemotherapy is to destroy rapidly dividing cells throughout the body. It's administered intravenously into the bloodstream so it travels throughout the body, whereas radiation therapy is more targeted. The idea is that it is focused on the tumor itself. There are healthy cells that can be damaged, but again, the hope is that the healthy cell damage is minimized and they can recover and only the cancer cells are affected. Newer treatments, which are designed to hopefully minimize side effects. One of the goals of gene therapy, or one type of gene therapy, is putting genes into cancer cells themselves to make them more sensitive to the treatment the person is receiving. Immunotherapy or immune cell therapy uses the patient's own immune system to target the cancer cells. It uses the patient's own immune system to target cancer cells. So you're attaching antibodies to drugs that carry them specifically to the tumor without killing healthy cells. This has been revolutionary in the treatment of cancer. With immune therapy or immune cell therapy treatment, only the cancer cells are affected. The risk of destroying healthy cells is much less because the antibodies don't recognize healthy cells. They only recognize the cancer cells. In terms of guidelines for reducing your risk, you can look at these: activity and body weight, diet and nutrition, and special recommendations. Please take a moment to kind of stop and watch this guy and pay attention to the reality that there are a lot of unethical snake oil salesmen out there that want you to buy their treatments, take their pills, and they have no idea what you're doing to your body. This is cocktail chatter, but it may be helpful in terms of knowing what are some of the screening tests that are out there and what the current recommendations for how often they should be done. These next two slides contain the recommended cancer screenings. Understand again that I recommend for your demographic, this last one, the skin cancer screening, where you make an appointment with a dermatologist who can let you know the difference between your moles and your freckles and help you understand that if you see any changes, it might be something for you to look at. The assignment for this topic is another interactive body map. As always, please have a look at it and follow the instructions and email me a 1 to 2 page write-up on what you find out. Thank you.